One of the things that is constantly comes up for us is there are these women who feel like they've just fallen out of the healthcare system and they don't know where to go for their issue. And they're just kind of like, I have these symptoms. They're not normal. I don't feel right, but I don't really know where to go. So I'm not going to do anything.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Felicity Yost, co-founder and CEO of TIA. In this episode, we discuss TIA's mission to redesign women's healthcare, combining primary care, gynecology, mental health, and more under one roof. Plus, Felicity shares how TIA is bridging preventative and longevity care through in-person clinics, hybrid services, and health system partnerships. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Felicity. Welcome to Fitt Insider. Thanks for joining us.
Hi, thanks for having me.
To kick things off, can you introduce yourself and tell us about what you're building at TIA?
I am co-founder and CEO of TIA. TIA is a revised or reimagined women's healthcare model. We're all about helping women find a home or a center for their core care. We started by building a center that integrates primary care and gynecology. Oftentimes, if you talk to women in the world, they'll say they use their primary care as their gynecologist as their primary care. They're not really sure who to go to for what. And over time, we've really continued to innovate and take a stance that we need to help women find a way to navigate their care needs through the lens of through the way that women actually think about what those care needs are. And so oftentimes when the medical system approaches care needs for women, they think about it in their specialty silo. So they'll say, oh, this woman has a GYN issue, or she's pregnant, so needs to see an OB, or she has a rheumatological issue, instead of taking a step back and saying, okay, as a patient in the world, this woman is experiencing XYZ. She's experiencing migraines, for example, and that could mean that she needs to see GYN to address her hormones, but she might also need to see a primary care to think about her nourishment or her exercise or do some basic blood work. And so it's really about building a comprehensive home for women to more systematically address healthcare issues. So today we have been fortunate and lucky to build 10 sites or centers across the country. We're in 4 markets: New York, San Francisco, Phoenix, and LA. We've about 70,000 women that we're serving across those 4 markets. In each market, we actually partner with the health system as well to ensure that there's strong continuity of care or kind of referrals into specialists when is necessary or needed. And that's, a key part of what we do. And I'm happy to talk more about that. But that's a little bit of the model in a nutshell.
It seems like it's accelerating now, maybe even on a daily basis, in terms of the different services focused on women's health or menopause or perimenopause, fertility, like all these different things. Whereas not that long ago, and I'm sure even around the time that TIA was getting started, it's like, where do we even start to chip away at this problem? And you mentioned around like OBGYN versus primary care. It's like, how do you, I guess, do you think about like even siloing or picking and choosing like what falls under that umbrella now or what doesn't, in terms of like how you approach that overall holistic care?
When people ask us, what's the hardest thing about running TIA? And this question exactly, where do you stop and where do you start the services that we do? There is so much opportunity for us to do so many different things. We have ongoing desires or inbound from patients asking us to be their dentist, for example. And so the what constitutes whole person care can really be a very wide spectrum of things. And of course, when you're building a company, you have to be focused and you have to choose a starting point and an ending point. So what we have anchored on is how can we build the services that are really necessary in a preventive care setting. We started off early on recognizing that preventive care is typically the doorway for a woman into the healthcare system. And it's also oftentimes the first thing that goes, in the sense that, like, a lot of times women will just fall off the track of doing their core preventive services, and then will end up finding out that, she has some real concern. Maybe she's breast cancer, maybe she has cervical cancer, maybe she's struggling with diabetes, and has to go into a specialist. And it's late stage at that point. And so what we have really said is, like, how do we build services that are anchored in that preventive care framework? But, like, longevity care is very popular in the vernacular today, and it's really the same thing as preventive care. And so we can talk a little bit too about that and what Tia does on that framework. But when we think about preventive care, really what that is establishing a relationship with the healthcare system. And a lot of what we think has gone by the wayside in terms of what healthcare services are offering today is a real relational care. And so you think about, like, how do you actually have a provider that you know and you trust and you feel like you can rely on? That is what Tia is trying to build. And so it's kind of the high frequency of visits, is a person that you reach out to the first time that you think there's something going wrong, is a person you see every year. It's a person who's tracking how you trend over time. And so that's really the person that we are for our patients.
Like this idea of preventative care, holistic care, and now you're starting to get this the kind of longevity wrapper around, like you talked about. Like, do you find that difficult in terms of like having to articulate, look, we are doing longevity care, if like that's the thing that you're looking for. We are offering these services and providing that longitudinal care that's oftentimes absent from like a, if you're getting a blood test and blood panels, if you're getting a, an MRI scan, like you don't have those other things. I guess the question is that making it easier or more challenging for where you sit in that like spectrum?
Yeah, I think it's just making it different. I mean, as you kind of said earlier, it's been this really rapidly changing environment around the consumerization of healthcare and the consumer knowing what they want. I think in this context, talking about longevity and is really just talking about preventive care. This is just a branding exercise. And so it's really just about putting it in the context of what does it mean to a patient in the world. And that's been something that we've known from the beginning we have to do. We have to translate a lot of what is in the medical vernacular to make it make sense to a patient. And so being able to say, hey, yeah, our preventive care is actually that longevity care that you want. We do that. And by the way, comprehensive longevity care actually looks like a lab panel plus a provider interpreting it and giving you recommendations. This is what we do. And this is actually our core bread and butter. We've been doing it for a very long time. We have to constantly keep up with the marketing and keep up with what's happening in the consumer arena. It keeps us on our toes. But I think it also is super exciting time for us because there's more patients who are looking for that now. And that's been something that we've believed is really necessary and critical for women for a long time.
This marketing piece that you kind of talked about, a branding exercise, and like I think that's really smart. It's like you have to figure out how to talk to that person who's looking for this thing that maybe doesn't know that that's what Tia also provides. And so you can message it kind of different ways. And then there's kind of different, whether it's touch points or areas of differentiation where it's like you have the kind of hybrid care that sometimes isn't always available, right? It's like you have it digitally, or you don't have the option of seeing somebody in person. You have like a revenue model, I guess, that you could differentiate on. So like what are the things when you look at and kind of go down that checklist of like, this is how and where we can stand out beyond just like this, what is the services aspect of it?
It's how we design services to go together. And so it's similar to the marketing of it, but we actually talk about it as the productization of care. Historically, the medical world has underinvested in understanding how does a patient in the world understand what they need. And so patients often feel underserved by the medical system because they don't know how to navigate it. And so what we try to do is really build something that speaks to the patient. And this goes to everything from designing a menopause service line that has different specialty care needs embedded in it. So it's like not just primary care, it's not just EGYM, there's mental health, there's dermatology, there's nutrition. All of those things need to be comprehensively strung together in one of these service lines. And it's not just like, a provider saying, hey, by the way, you should probably go see this other provider. It's like, really setting the patient up to be navigated into those things. It's also really tiny things or things that seem super tiny on the surface, like just the basic, how do you name an appointment that makes sense to a patient? If you go onto a lot of hospital systems websites or, GYN practitioners' websites, they'll have what they do listed there. But as a patient or role, oftentimes you're like, what is a leap? Like, I have no idea if I need that. Is that what I have to book? And so it's those tiny little details in addition to some of the more systematic details that I think is an innovation for us. And then I would also say what we really, really pride ourselves on is how we actually help a patient feel in the process or in the journey of making a decision about herself. And this is so nuanced and so hard to actually kind of pinpoint, but is like, I think the biggest innovation, unfortunately, that we've made in the healthcare system, which is women have historically felt incredibly shut down by basic, by care. They don't feel listened to. They don't feel like the system is there to support them. The number of patients that come to Tia and say, I'm just here because I had a bad care experience in my last provider is, astounding. And so that's really what we kind of think about in every step of the journey. And that's how we're trying to transition the standard of care that's delivered to women.
And then when it comes to the kind of having physical centers, like that's obviously in the space something that stands out, right? There's kind of the telehealth has accelerated in a way where it's like any service, any prescription, any kind of when you talk about the front door, but having element of like having physical locations. What's the thought process one behind that and like actually scaling them? And is there tension to kind of be more digital or digital only or digital first? Not to say this is not like a important part of the business, but balancing those things is super challenging.
It doesn't make our lives easier to have physical locations, but I think it's super important. I don't think you can deliver comprehensive care for women on the internet. We used to make this joke, which is like you can't get a pap smear on the internet. There are now at-home tests available for cervical cancer screening, but it's still to say you can't really get the full comprehensive physical exam on the internet. And it's beyond just like the preventive care portion of it. We need to do a lot of other things in the site that cannot be done virtually. And I would also say that it kind of gets back to this component around building a real longitudinal relationship with a patient and really that patient feeling like they have a center or a home that they can go to. And we've seen that, patients who come into our sites and engage with us physically actually have a much higher retention rate. Their outcomes are better. And so there is a real validation behind actually building physical centers. I also think that when you have a virtual only platform, the ability to actually deliver real comprehensive care is limited. And so that's why a lot of the platforms out there are, they're more point solution oriented, which is, necessary in and of itself. And I love to say this, which is every single entrant into the women's health market is a friend because there couldn't be enough more care. Like we can't bring more care online fast enough for women. But I do think that we need to balance the number of point solutions with actually more comprehensive solutions like what Tia is doing. And I will say to date, Tia is still the only provider on the market that's doing comprehensive primary care for women with physical centers. And really figuring out how to actually systematically integrate with health systems to ensure that there is a real continuity of care into the specialty care realm as well.
Like around that point, maybe zooming out a little bit, we talked about like obviously the need for more women specific services and that traditionally this has been largely overlooked. And when you think about where Tia or any other provider that's kind of serving this market, there's to me, it's like always an interesting question of like, does healthcare, traditional healthcare, broader healthcare systems need to do a better job? Obviously, they do like need to do a better job of serving women and providing more preventative services and providing logical, like all those things. Or is that opening just like where companies like Tia need to exist and can thrive because they are providing it? Like, does traditional healthcare change, or does it kind of get changed from the outside by companies like Tia who are just pushing for better personalized preventative services?
Yeah. So there's a really challenging issue for health systems right now, which is that they are under an incredible amount of pressure to expand access in the primary care setting in particular. A lot of systems have excellent contracts with payers. Those payers are coming to them and saying, hey, we're not going to actually reimburse for your specialty care service if you don't have a primary care clinician actually interface with the patient ahead of that specialty care service to bring down the cost of care. And then in general, there's a lot of pressure in the communities to have more primary care offering. And so the systems are under a lot of duress to build more primary care. The problem for them is that they typically cannot do this profitably. They lose a lot of money doing primary care. It has to do with their staffing. It has to do with structural or institutional costs that they incur by just having to stand up facilities themselves, et cetera, et cetera. And so solutions like Tia, where they can partner with us to be their primary care solution, is a win-win for them. We're profitable. We capture a demographic of patients that really don't want to go to the health system for these types of services. We can send patients into them if the specialty care need is there. We're a lot more nimble than a health system. We typically are able to build a site a lot less expensively and a lot more quickly than a health system can. And so just kind of more succinctly, the answer to your question is it's like a both and situation where they need to invest in partnerships. They do need to invest in their own primary care. They would do better kind of standing up those sites for a different demographic, but they still really want our demographic. There's a commonly cited adage in the healthcare world, which is the women are the CFOs of the family and they comprise 80% of the healthcare spend, which means that the demographic Tia serves is incredibly valuable to these health systems. They really want to serve these women, but they ultimately are struggling with the consumerization component. How do they build a model that women actually want to use? And that is not really their bread and butter.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. This kind of relates to scaling in terms of like geographically opening different centers, but on the point of partnerships, how much of a role does that play in determining where you are locating? Is a system or partner saying like, hey, we'll bring you here basically, and it's like that part of the partnership, or are you going out and saying, hey, our demographic is located in this city. Let's go there and see if we can also imagine probably both of these, but because the demo is there, and we'll also find a partner kind of as we do that.
We will approach partners and go to markets and say, hey, we really want to be in this market. This is a super strong demographic, or you guys have a real primary care shortage. There's a need here. And then once we kind of decide on who that partner is in that market, then we go through a process of selecting locations. And there's a huge number of data points that we pull into that. It's like selecting the location is kind of one of the most important parts of what we do. And so it's like, where is the demographic within the market? Where are their primary care shortages? How close is that to what the health system has already? Ensure that this kind of metric around drive time to a site is incredibly important in our business. You think about like, okay, if they have to drive super far to a specialty care center, that's going to be a problem and create drop off. And so we had to balance all of those things. And then we are trying to find locations that are not in medical office buildings and are in kind of, you know, spaces that people want to go to. So a lot of our centers are actually in places where, women work or live or shop. We love to be in kind of like modern shopping centers. So in LA, for example, we're in something called the Platform, which is, a ton of different stores, but it's right near like Snapchat and a bunch of these kind of tech offices. And so that's like a slam dunk location for us in the sense that you kind of get the best of working and playing, if you will. And so those types of locations are great for us. And we want it to be more of a feeling of like, this is a place that is integrated into my life. I'm not driving somewhere 45 minutes outside of where I want to be to go to the doctor for 20 minutes.
There's a few different kind of recent conversations I've had talking about whether it's a fitness studio or a longevity clinic, or you kind of name the kind of modern wellness amenity, like thinking about where they want to co-locate. And I always think back to, we used to do some work with Lululemon, and like they would say, oh, we want to be in proximity to a Whole Foods and an Apple store. And it's now thinking about like that modern real estate stack for like a Tia, maybe a Berries, or like whatever it might be, an Equinox, like those types of things. Yeah, it's interesting to see that shift kind of happen in real time.
Yeah, I mean, it's funny because we put Lululemon as one of the things that we look for in, shopping for locations. Whole Foods or Trader Joe's as well. In LA, it's like an Air One. Berries is a great proxy. There's a veterinary brand called Modern Animal that we're actually co-located with in a bunch of locations. Another pediatrics nursery school brand called Brella. And so these types of things, we kind of find where they're going and they tell us where they're thinking about. And so those are great ways for us to get early indicators on, new markets that are popping up as well, because that's also one of the hardest parts of real estate is things change super quickly. And we typically sign like a 10-year lease. And so we really have to think like, okay, what's going to be the right place in 2 years, 3 years from now, as well as right now, as well as 10 years from now. And so it's a super interesting process.
Yeah, maybe a couple more questions before we wrap up. One being like, there's this, whether it's consumer driven or market driven or even kind of, you know, hype driven, for lack of a better word, like, oh, what is the future of women's health or preventative health? And a lot of things we've talked about today. Does Tia have like this, your own working definition of like, this is what we think the future of this space is, and like, this is how we're going to like usher it in?
Yeah, I mean, I think there's the here on the ground today future, and then I think there's actually the future. And the here on the ground today future is, I think, a lot of what's happening around longevity currently in the sense of how do we expand our notion of what health is through different kind of lab values that we can run or other types of diagnostics and actually build out a more comprehensive health profile. We're at the early innings of this because, to be frank, it's very hard to actually say from that data what is healthy in the sense of how do you impute a longevity score from all of that data. And in particular, in the women's health realm, what is very interesting to a lot of women is what we call like ovarian age. Where are you in the fertility cycle or process as you naturally kind of progress from highly fertile years into menopause years and all of the kind of transcending health implications of that. And really starting to understand biomarkers that can relate information to us about where a woman is or isn't on that reproductive lifespan, if you will. And so I think, we're in the early innings of that longevity phase. I think that's really exciting and interesting for us. But what it really is about building out more data. And this is, step one to getting us towards actually a much more comprehensive understanding of what do we need to know to assess what somebody's longevity score is, and then how do we actually counsel on it. And this is the piece that I think is actually like very exciting, where we can start to use that data, build models predictive models that are much more comprehensive and complex than we've ever been able to do previously, where you can take multifactorial inputs and then say, okay, based on this, we need to actually both, we're assessing that this person's longevity or score, age score is this, but we also can do X, Y, and Z thing based on their genetic profile, based on, whatever they're doing with their lifestyle, their stress load, et cetera, to improve where they are. And so I think that's actually the future. And so, like, in a more succinct way, basically, it's how do we actually move from collecting data to counseling patients on things they can do differently that are going to have real outcomes for them? Right now, it's a little bit like spaghetti against the wall, and we don't exactly know. We just are saying, well, baseline, like these 5 things in terms of like good, healthy lifestyle are what you should do. And it's not exactly clear that that's the right thing for each person given their individual status.
Yeah, that's actually like a really thoughtful articulation of personalized care that I think is lacking a lot of times when you hear such and such company is launching a AI health coach, or there's this that you can stack and you're going to get personalized recommendations and insights. And it's like, okay, well, where in this health journey am I getting the intervention that I need at the moment I need it, like tailored to me? And then these are the outcomes on the other side, which is always the thing that's kind of like, okay, but like, what about it? And like, how do we get there? And so that kind of, I guess, answers another question I had, which was like, where do you see the opportunity to actually drive better care and business outcomes? Like, do you see this like data piece being aligned, and that yes, it's like delivering kind of like a win-win?
Yeah. So I think the data piece is huge. And where I think we could use a lot more innovation in healthcare is actually on building interesting algorithms to understand the data. And actually, like, we can test hypotheses on data sets too. So, one of the biggest, 2 big blockers there. One, we just need to be a lot better about aggregating comprehensive data sets that have longitudinal data in them. The second thing is that we actually need to be better about empowering people, like researchers and scientists, to get access to that data and then provide us interesting insights that can help us frame interventions or, clinical recommendations. There's a lot of dollars flowing into medical devices for women's care right now, but there aren't as many dollars actually flowing into just basic research like that. The question is like, how do you monetize that model? That could be an entirely other podcasts to discuss, but like, I think that those 2 things are areas where we could see a lot more innovation and actually then have, real different future of medicine for women. And the challenge is just actually collecting that data and aggregating it in a way that's usable. That's the first challenge, at least.
As we wrap up, and I guess like more near-term future, we talked about a couple different futures. What's, whether it's on the roadmap or top of mind for you in terms of like, hey, this is what we're doing, maybe what to look out for, or things that are kind of like coming up next for Tia?
Yeah, I mean, I think like doubling back to where we started, Tia is continuing to invest in more of this kind of like productization around longevity services. One of the things that is constantly comes up for us is there are these women who feel like they've just fallen out of the healthcare system and they don't know where to go for their issue. And they're just kind of like, I have these symptoms, they're not normal, I don't feel right, but I don't really know where to go, so I'm not going to do anything. And or, I'm going to struggle through it. And we're really trying to build solutions for women who feel that way. And one of the new solutions that we're bringing online right now is an appointment that we're calling Longevity and Vitality, which is all about helping a woman assess, why don't I feel normal? A lot of times this can be related to perimenopause. A lot of times it's related to an autoimmune condition. A lot of times it's related to the fact that women do all of the work and the home and family stuff, and they're just exhausted. But like, how do you parse that out? And a lot of providers today actually don't spend the time, have the resources, really the clinical thinking to back up and a diagnostic process behind that. And so that's something we're really excited to bring online because I think the number of women who express that type of sentiment, I just don't feel normal, is massive. And we want to help women who are feeling that way I feel like there's at least a answer to how you could start to get some answers. And so that's an exciting new appointment, our care journey that we're bringing online. In next week, actually, is when we'll be launching it. So that's something we're excited about.
Great. We will make sure that's easy to find in the show notes when it does come online. This will be out by then. And if for anyone that wants to learn more about that in general, is website, social, where would you point them?
Yeah, astia.com. And you can go on there and access everything from just signing up and kind of seeing what our appointments are to educational resources that we produce. We also have a podcast called It's All Connected, where we interview different providers about complex issues. So any and all of those things.
Perfect. Everything is linked up below. Check that out. And Felicity, thanks so much for joining us today.
Thank you.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.